Good day, everyone. In this video, we are going to continue the discussion on the pulse diagnosis. In the previous video, we have introduced several pulse manifestations, and from this video, we are going to introduce some of the pulse that is a combination of the previous pulse manifestations. A surgeon pulse. A surgeon pulse is a forceful. So the characteristics of the surgeon pulse: forceful, excessive, large. So these are the characteristics of a surgeon pulse, both in the length and the width. Which pulse we can feel that is large, the length and the width, such as the large pulse, the excessive pulse. So you can feel forceful. But this kind of forceful is slightly different to the excessive. The excessive pulse, we also can feel forceful, but this forceful is like falling waves. What kind of feeling is a kind of falling wave? As you can see the waves in the image. The waves, you can just imagine the force from here, and then all of a sudden, there's no supports. It declined there. So this kind of pulse, what you feel, you can feel the pulse coming very strong, but all of a sudden, something you don't feel, or you feel less. And then afterwards, you feel another pulse. Again, you feel very forceful, but all of a sudden, you stop. And then that's kind of feeling that's described as falling of waves, declines sharply. So that's a surging pulse. A surging pulse, although the feeling declines sharply, so it declines sharply, or even from here, declines. But even when it declines, even when you feel here, the pulse declines, you feel weaker, but this weaker still more forceful than a normal pulse, than the moderate pulse. Then you will know this surging pulse is a kind of excessive pulse. And this can indicate excessive heat. So that's the feeling. You can feel declines like waves. This kind of feeling. The indications is the heat, and this also can happen in a healthy person in summer. So that's the pulse going to be affected by the seasons. What seasons? In autumn can be floating. In summer it can be surging. This can be normal. That's because of the excess yang qi in the environment. In summer, this can affect our human body as well. A large pulse, both in length and width, you feel all three regions, and you also feel thick, this pulse. The difference between the large pulse and the surgeon pulse is the force. The large pulse, you can feel the even force, a very even force. It is not like the surgeon pulse. You feel and then sharp decline. That's the difference between the large pulse and the surgeon pulse. A large pulse can happen in a healthy person. It also can indicate an advanced stage of disease. This advanced stage is actually can indicate the development of the disease. So it can indicate that the disease is developing to a worse condition. That's also because of the theory that's described in 黄帝内经. It says that if the disease is developing, you can feel the pulse is large. That's because of the pathogenic qi, pathogenic factors, excessive pathogenic factors going to make the pulse felt large. So in this situation, you need to identify a healthy person or a pathological condition. A healthy person, especially for in a strong body constitution, strong body build, the patient will have large pulse. Thready pulse. A thready pulse, you feel like very thin, like a piece of thread, but clear, palpable. It's also called a thin pulse. So this is very different from the large pulse. The large pulse, you can feel very thick. You can feel very thick, but the thin pulse, you feel the thready pulse, you feel very thin. So this situation, you also can feel in 寸, 1, 尺 area, but under your finger, the feeling under your finger is thick or thin. The thin feeling is very similar you touching your index finger, your middle finger, your ring finger. These three fingers in touch, you will palpating on a thread, that kind of feeling. A thin pulse indicates the deficiency of qi and blood. The reason is because of the thin. The reason of the thin pulse is because you don't have enough qi and blood in the vessels. That's why it can indicate it can present as a thready pulse or thin pulse. So it can indicate the deficiency. It also can indicate the dampness. Sultry pulse. A sultry pulse is superficial thread and can be felt with a light pressure. This pulse, superficial, threading, also thin, and felt with light pressure. So as you can see from here, sultry pulse, superficial is a kind of floating pulse, but this kind of floating pulse is thin. So that's the characteristics of the sultry pulse. When you compare with the sultry pulse and floating pulse, these two are all superficial, but the floating pulse is not thin. It also can be feel less, can be felt less when you press more, but you still can feel. You still can feel, but the sultry pulse, you feel weak. It is not only can be felt with light pressure, you also can feel forceless. So general, indicates deficiency and dampness. So as you can see, the indications from a sultry pulse and the thready pulse are quite similar. A weak pulse. A weak pulse is extremely soft, deep, and thready. So the difference between a sultry pulse and a weak pulse, they're all very thin, thready. They're all very soft, very weak, but one is superficial. The other one is very deep. That's the difference. So during the study, you need to try to find the similarities and differences between or among different pulses. These can help you to remember better. Otherwise, after we introduce 28 pulses, you're going to mix them. A weak pulse presents as blood force to fill the vessels. That's why it becomes thin. We don't have enough blood, fails to fill the vessels. Qi fails to circulate the blood deep. Why the pulse feel at a deep level? That's because the qi cannot promote the blood vessels go to superficial. That's why it stays at the bottom. So that also can indicate a weak condition or insufficient qi and blood, or in the other words, qi and blood deficiency. Fainting pulse. A fainting pulse is extremely thin, soft, and barely palpable. It may be felt, and then sometimes it's lost. So which means the fainting pulse is also very thin, extremely thin. That's even thinner than the Thready pulse, than the Sochi pulse. Also very soft. Also very extremely soft, barely palpable, which means it's very hard to palpate. Sometimes you can feel, sometimes you don't feel. That's because the pulse is too weak to be felt. This can indicate severe or extreme deficiency of qi and blood, decline of yang qi. That's also the deficiency of qi. A slippery pulse. A slippery pulse feels smooth like pearls rolling on a dish. What kinds of feeling? As you can see here, the pearls. You just imagine that you try to feel or you try to push your fingers on top of these pearls. What's going to happen? The pearls is going to rolling away. As you touch, as you push, the pearls is running away. Right? So that's this kind of feeling. So what you feel from your fingers, your index finger, your middle finger, your ring finger, what kind of feeling? You can feel the pulse, and immediately, all of a sudden, the pulse ran away. And then you can feel again, and all of a sudden, it goes away. This we call slippery pulse. The slippery pulse also need a speed. So a slippery pulse should not be a slow pulse. That's because when you are pressing the pulse, from the description, when you pressing the pulse on a dish, the pulse will be run away quickly. So a slippery pulse indicates phlegm fluid retention, indigestion, or excessive heat. A slippery pulse, from all these pulses that we have introduced, the floating, the deep pulse, the excessive, the deficient, the thin and large, and then now the slippery. The slippery pulse, it is a benefit for growth. So for females, during your period, before a few days before or after your period, you can try to feel your pulse. Most healthy ladies, you will present as a slippery pulse. So that's how you can study the feeling of slippery pulse. You can feel your pulse during your period, and also you try to feel your pulse 1 week after your period. You try to identify the difference. So the slippery pulse is one of the most common and very easy to be identified. This slippery pulse, also the pulse can indicate for sufficient qi and blood. So you can see the patient is sufficient, have enough qi and blood. That's why the pulse flows very smoothly. This also can indicate weaning during pregnancy. It can indicate the menstruation. It also can indicate if a lady come to you due to delayed period, and then you feel the pulse is a slippery pulse. You need to be careful that you do not use the herbal medicine or acupuncture points to activate the circulation to try to recover the period, because in this situation the patient is pregnant. If you use activating blood herbs or activating blood qi and blood acupoints, it may cause miscarriage. So in this situation, you need to be careful. Ask the patient to have the test for pregnancy. This also sometimes in the movie you can see a practitioner is feeding a lady's pulse, and after a while the practitioners will say that congratulations, what's going on is the pregnancy. How does the practitioner know that the patient is pregnant? That's from the pulse feeding. When he feels slippery pulse plus delayed period, then in this situation, we can see that the patient might be pregnant. So for this, you can try to study on yourself, or on your for the boys, you can study on your friends or on your classmates. Try to practice more. Try to identify from your fingers. Try to identify the difference from the fingers. A throbbing pulse. A throbbing pulse is slippery, rapid, forceful, feel like a beam, strong and throbbing. So what kinds of feeling? Slippery, first slippery, rapid, very fast, forceful, the tension. It's very similar like a beam. When you press on a beam, because a beam is solid, so you can feel forceful. So that's the kinds of feeling that you can feel. This indicates pains or fright. A choppy pulse. A choppy pulse feels like numbness and difficulty, like a knife scraping bamboos. A knife scraping bamboo. What kind of feeling do you feel? So the bamboo is not the big bamboo that you can see in the gardens, the long one. A knife scraping the bamboo is like this kind of bamboo roots. They got a lot of knobs here. So you imagine that now you use a knife, you use one knife, you try to move from one side to the other on the skin of the bamboo. So once they reach the knob, you will stop. And then you can move again and then stop. You will stop by the knob. So that's this kind of feeding. And this kind of when you scrape the bamboo, you use a very soft force to scrape, which means it's very similar. You use a bamboo to put on top of the bamboo and move from one side to the other side. You can imagine that's what kinds of feeding. That's the knife going to be stopped by these knobs. So that's a choppy pulse. How a choppy pulse feel like. The indication of a choppy pulse is the blood stagnation, blood deficiency, qi stagnation. So that's the qi stagnation, blood stasis. And also what's very important here is when a knife scraping a bamboo, when you see a real bamboo, you will see the space between here, one knob to the other knob. The space is not exactly the same. So that's another characteristics of chopping pulse. Sometimes you might feel slightly longer or slightly shorter. You also can see the bamboo roots, the knob. Some of them are higher, some of them are shorter. So from here, the knife may experience more stop or more force to stop. And then when the knife move here, it is smoother. So which means the pulse you can feel more forceful or less. It's not even, slow and not even. That's a choppy pulse. Thumb. So you need to add here one. Choppy pulse is thumb. Thready, slow, and the waves is not even. It'll be very slow and steady. That's a choppy pulse. Wiry pulse. Wiry pulse is described as straight. So the pulse you can feel is straight, long, it's more than 3 sections, 3 divisions, 寸关次 divisions, and tenths. What kinds of feeling? You try to feel pressing a tie string of a musical instrument. So you try to feel the wire here. You put your 3 fingers on the wire, that kind of feeling. Wiry pulse, straight, long, and tense. So it's forceful, as you can feel in the on the string. A wiry pulse can indicate the stagnation, especially for qi stagnation. From the liver can indicate the pain, the fluid, the phlegm, the failure of qi. The failure of stomach qi is also due to the liver. You still remember that's the examples we studied in the basic theory. The liver problem will affect the spleen and stomach. That's the wood can affect the earth. So that's the wiry pulse. A wiry pulse mostly related to the liver problem, the pains, the phlegm, and the failure of stomach qi. So these are the analysis of a wiry pulse. A wiry pulse also can be seen in spring. That's also the physiological changes according to the seasons. A tense pulse. A tense pulse feels like a stretched and twisted rope. What kind of feeling is a stretched and twisted rope? Have you seen this kind of exercise or this kind of competition? Two group of people pulling the rope against each other. So one's pulling this side, the other one pulling the other side. So the rope, this rope, is a stretched and twisted rope. As you can see from the rope, it's not smooth because it is twisted. And the twisted rope, two force is pulling against each other. So you can see this kind of pulse is also forceful and stretched and very tense. That's the characteristics of this pulse. Why the pulse become tense? That's because of the cold condition. This is very similar. In a very cold condition, you feel cold, and then if you feel like trembling or you feel shaking, and then your muscle going to spiral, and this muscle spiral also you will have the vessel spiral. The vessel spiral kind of spiral. So here it's not actually spiral, but try to help you to understand the description. You can imagine that if the vessels actually is kind of spiral, the walls of the vessel become spiral. That's this kind of tense pulse. And then you will see this, where does the spiral come from? It's the result of a cold condition. It also can be a result of pain. So that's the tense pulse. We still have about 3 different pulses we're going to introduce in the next video. Thank you for your attention.